Breast cancer. 2 words that can strike the deepest fear. Well, Fighting Cancer Network is here to provide you all the information you need so you can help your doctors help you get better. So let's start with the basics. Remember, if you ever need to look up any terms, check the glossary and use the notes feature as a reminder to talk to your doctor. Now, because most breast cancer appears in women, we're going to concentrate on the anatomy of females. So let's talk about breasts. Get to know your breasts. What do they look like? How do they feel? This is your responsibility and gives both you and your doctor a baseline, something to work off of, making it easier to detect changes. Small lumps and bumps are completely normal, so just make some mental notes. And if you have implants, same thing. Just get familiar with your breasts. Normal means normal for you. Okay, all children are born with nipples overlying a small amount of undeveloped breast tissue. Now, in genetic females, mammary glands develop during puberty when the hormone estrogen produced by the ovaries binds to estrogen receptors, abbreviated ER going forward, in the breast. Estrogen hormone stimulates the development of an extensive network of branching milk ducts from the enlarging nipple as the female matures. The purpose of these ducts is to drain milk produced deeper in the breast to the nipple. This network of ductal tissue defines the size and shape of the breast, extending upwards toward the collarbone or clavicle, downwards toward where the breast meets the abdomen at the breast fold, inframammary crease, toward midline at the breastbone or sternum, and to the side towards the armpit, axilla. All of the breast tissue lies between the woman's skin and the pectoral muscles on her chest wall. Differences between the breasts or asymmetry in their size or height is common. It's normal and not a cause for alarm unless it is new or changing. An inverted nipple that points inward or lies flat is also common and may be completely normal for you. In addition to ductal tissue draining to the nipple, milk-producing lobular cells form glands throughout the breast, but these don't become active until they're stimulated by the hormone progesterone through binding to progesterone receptors, or PRs going forward. A process that begins during pregnancy in preparation for milk production and breastfeeding. Now, some women notice changes in breast size, texture, and sensitivity through their menstrual cycles due to normal changes in estrogen and progesterone levels that stimulate the ductal and lobular tissues. This is completely normal. Just be aware of what is typical for your body. The ductal and lobular tissues are protected by surrounding fat, adipose tissue. During a woman's lifetime, the proportion of glandular tissue to fat gradually decreases, leading to decreases in breast firmness and density that change its shape. This especially happens after menopause, when the ovaries stop producing estrogen and progesterone. Again, be aware of your body and what's typical for you. Now, you may have heard of lymph nodes and lymphatic vessels, but most people really don't know what they are or even think about them unless there's a problem. Having lymph vessels and nodes is perfectly normal. They're a network of very fine draining vessels that help extra fluid drain to the lymph nodes in the armpit. This also assists the immune system. Of course, there are also nerves and arteries and veins providing oxygen and nutrients to the breast, just as they do throughout the rest of the body. So to sum it up, breasts are very complicated organs. And now that you know what they're made of, how do you best care for them, and can you spot when something doesn't feel or look quite right? Because all of the breast is located between the skin and the muscles of the chest, physical examination by your doctor through merely looking and touching with slight pressure should be part of your routine medical care. Most women have small lumps or bumps within their breasts, and that's perfectly normal. There's a lot going on in there, and your breasts can reflect changes through your life. That's why you and your primary care physician should make notes so you can determine a baseline, making it easier to spot changes as they occur. Most things you notice are perfectly normal and not dangerous at all. Dense breast tissue, palpable ducts, benign cysts, and so forth. But make certain to point out anything you're concerned about to your doctor, just to make sure. What if you've had breast implants? Implants don't usually change the breast tissue because they're placed behind the breast tissue next to the pectoral muscle. So now, something doesn't feel right. That lump is a little bit bigger and harder than I remember. Something doesn't look right. My skin looks like an orange peel right there. And that discharge from the nipple? It's odd. Is it time to panic? Nope. Is it time to get more involved in your health care? Yes. Helping you get involved in your health care is the only reason Fighting Cancer Network exists. So go ahead and make that appointment with your doctor. Oh, and this goes for both men and women. Again, all the terminology is in the Fighting Cancer Network glossary. Feel free to review and use the notes feature as a handy tool when you talk to your doctor. This is your time to get to know your body. And speaking of your body, it's time to talk about exams. Self-exams, routine exams with your primary care physician, and taking charge.